there's a lot of anecdotal reports, popping out all over the place that perhaps when you get an epidural, remember 65% of American women deliver, their children with epidural, which is putting a needle in the bag and then injecting
in our house.
100%. I know. And the theory behind, having a tattoo, and maybe when you put the needle through the skin, that you can carry a small microscopic piece of skin with the chemical of the ink, that could cause an inflammation and chronic pain. And there have been a couple of anecdotal reports, although no prospective studies have been made. Now, the argument is that, with more epidurals and more tattoos covering the whole lower back, this might be a problem for some women down the line.
So if you were going to do it,
if you're going to do it, I would argue
that was the way to do it, right?
That is one way to do it. Especially, remember, if the best thing is not to have your skin painted at all. I think
use henna. I went through that phase. Put henna on instead. It goes away, and you don't have to try to think about how to explain it away to your kids.
I think I would not. If you're going to get an epidural, don't worry about the tattoo. I think most physicians nowadays are bypassing, whenever possible, the tattoo mark. So
can you?
Well, it depends where the tattoo is.
I remember you going down my spine doing the counting thing and going, okay, here's where it's
looking
going.
for the spot.
Yeah,
but sometimes you can. I do the same thing when I do a cesarean section. A lot of women have, tattoos in the lower pelvis.
Right.
And when I do a cesarean section, I try not to cut through the tattoo, not only to destroy the beauty of the tattoo itself, but also I don't want any of that, skin which has been tainted with that paint to heal inappropriately. I don't know what the long-term effects are, but I think studies are coming down the line. FDA is looking at it.
And so many young women are getting tattoos these days. It seems that it's something that you really do need to know.
Need to be a little bit, aware of.
Or just get ready for natural childbirth.
Absolutely.
All right, Dr. Manny Alvarez. Ouch! I remember that one time. What a mistake. All right, thank you.
You're welcome.
A college campus on lockdown.